Hello, everyone. Welcome to this week's lecture on birth and early infancy. So, birth can be a really exciting and stressful process, both physically and emotionally. It could be a complicated process as there are many decisions to be made, such as whether or not to use pain relieving drugs during labor or the location of where to have your baby. Over 60% of women in the US receive a regional anesthesia called epidural blocks during labor. There's also the option of using general anesthesia, which is typically used in emergency situations to act fast and making someone unconscious. Nearly all drugs given during labor passes through the placenta and enters the fetal's bloodstream, which can impact the baby even after birth. So in terms of the location of birth, 99% of the births in the US occur in hospitals, and the remaining 1% of babies are either born at home or in something called the freestanding birth centers. In this week's lecture, we'll focus on the process of labor, delivery, and the overall development of infants in the early stages. So let's get started. So for this next slide, I'd recommend downloading the study guide called Labor on Blackboard to follow along and use your textbook as a reference. As you can see, labor consists of three main stages. In stage 1, dilation and effacement occurs. So these two processes involve the cervix, essentially. Dilation is the opening of the cervix, measured in centimeters, and effacement is the thinning of the cervix, measured using percentages. Both of them need to occur for labor to progress. Contractions, or what you would typically know as labor pains, facilitates with both of these processes. So typically in a vaginal birth, the cervix needs to be dilated to 10 centimeters, or around 4 inches, and be 100% effaced for the baby to be able to come out. You can reference page 59 of your textbook just to see the differences in how long stage 1 typically lasts for first births compared to second or later births. The average length for stage 1 is about 8 hours for the first birth and 6 hours or less for later birth. And of course, this could last much longer as we're talking about average lengths here. And within stage 1, there are 3 phases: latent phase, active phase, and transition phase. So the way to kind of think about it is in latent phases, contractions are very far apart. They're not very uncomfortable. You can still move around. And then when you progress to active phase, you're going to feel the contractions much longer. They become much more intense. And when we enter transition phase, which is essentially helping you to transition into stage 2, this is where contractions are closely spaced. They're very strong and typically very painful. And then when you're ready, when your cervix is about 10 centimeters opened and 100% effaced, we enter the birth of the baby, which is delivery and vaginal birth, when the babies typically are head first and then face down. However, if their feet or buttocks come out first, that's called a breech presentation, and that often requires additional interventions such as C-sections, which we'll talk about in a minute. And then stage 3 is where you deliver the placenta and umbilical cord, and also known as afterbirth. So next we'll talk about cesarean deliveries or C-sections and birth complications. A third of births in the US are C-sections. So there might be medical reasons why a C-section might be optimal. These include the breech presentation we just talked about, fetal size being too large, fetals in distress, labor failing to progress, or other health and age concerns on the mom's side, as well as if someone is having twins or triplets or multiples. C-sections might be a way to minimize the risks involved and ensure safer chances of delivery. However, do note 3% of C-sections in the US are elected, which means there is no medical reasons why a C-section needed to be performed, but it was performed anyway. So next we'll talk about anoxia, which is one of the possible birth complications. This is when the infant is unable to get sufficient oxygen because the umbilical circulation has failed. It could be because the umbilical cord was squeezed somehow, or it just failed to supply oxygen. And this is a serious issue because it could lead to cerebral palsy or mental retardation. Next, we'll talk about the impact of low birth weight. Especially for infants born 5.5 pounds or below, they might be considered low birth weight. These could be infants who are preterm, so born before 38 weeks of gestation, or they're simply full term but small for date. One characteristic that they all have is a marked lowered responsiveness at birth and within the first few months of life. So this requires more careful observation to make sure they're thriving appropriately. For infants born 6 weeks before full term, they are also more at risk for respiratory distress syndromes, where their lungs lacks a chemical called surfactant that's needed to keep the air sac inflated. So additional interventions might be needed to help them breathe when they can't do that on their own. The good news is around 2/3 to 3/4 of the premature infants, you can't really tell them apart from their full-term peers by the time they all get to school. So what this is telling us, there's a lot of things that parents can do afterwards or a medical professional can do afterwards. Things like kangaroo care. So you've probably heard of kind of having skin-to-skin contact increases their chance of thriving. Massage therapy, responsive parenting, those are all good interventions and strategies to help low birth weight babies. So most physicians typically assess a newborn baby immediately after birth and then again 5 minutes later, using something called the APGAR scale. A stands for appearance, which is the color of the baby, pulse or heart rate, G grimace, muscle tone, A activity for body movement or responses to stimulation of the feet, and then respiratory rate. So for each of these categories, a baby could score either 0, 1, or 2, adding up to a total of 10 possible points. It's pretty rare for infants to be perfect and score 10 immediately after birth because there's still a little blue around the extremities, most likely. But around 5 minutes later, 85 to 90% of infants can score 9 to 10. And a score of 7 or above means the baby is not in immediate danger. Below that, the baby might require various type of intervention. 3 or below means the baby is in critical condition. So if you're curious about what an APGAR test would look like in reality, I'll link a YouTube video on Blackboard as well as in the comment section. So remember the first day of class when I asked you all whether infants are born with any knowledge or skill. If you consider reflexes to be a type of skill or knowledge, the answer to that question would be yes. We can categorize infant reflexes into either adaptive or primitive reflexes. For adaptive reflexes, examples include sucking, swallowing, or rooting. Rooting is when you stroke a baby's cheek. The baby would turn towards that touch, open his or her mouth, and then starts making the sucking movement. You can see these 3 reflexes are aimed to help with survival, and they typically disappear somewhere in the first year. If there's weak or absence of these reflexes, this might warn us of possible neuronal developmental problem. This is something to be checked out with a medical professional. Next, let's talk about primitive reflexes. These are controlled by the medulla and the midbrain, which is the less complicated part of the brain, much more instinctive. These reflexes should typically disappear around 6 to 8 months. And when the Moore reflex or the Babinski reflex, when they don't disappear, again, it might mean neurological problem that needs to be checked out further. So Moore reflex is when there's a loud noise near the baby or when you let the baby drop suddenly. The baby extends its arms and legs and arches its back and draws back its head. So this is also to kind of protect the baby's body. Babinski reflex is when you stroke the sole of the baby's foot from toes towards the heel and the baby would fan out his toes. If you're curious about what these look like or just want to learn more, I'll link a video down there for you to check it out. So have you ever heard of the saying, sleeping like a baby? This is to assume babies sleep very soundly, which could not be any further away from the truth. Well, it's true that newborn babies sleep 90% of the time. However, their sleep patterns don't really regularize until around 6 to 8 weeks of age. This is when something called the circadian rhythm kicks in, where they're able to distinguish night and day, and when they're starting to develop sleep patterns where they're sleeping longer. Do note that sleep patterns are very individualized. Some babies may not sleep or develop night patterns until 1 year of age. So these two figures show the percentile ranks among infants for various amount of sleep during the day and night. If an infant scores 98th percentile on either of these graphs, that means 98% of babies sleep less. 2 percentile means 2% of babies sleep less. As you can see, there's a general pattern of daytime napping decreases in terms of duration, and then nighttime sleep increases over the first year. This is when you can reassure the parents that you will get sleep again, and it could be longer than 2 hours at a time. The next question we're going to tackle is, can newborn infants learn? And if so, how do they learn? We've covered various theories on learning briefly in Chapter 1, and today we'll apply those to infants in early stages of development. First, let's look at classical conditioning. An example would be researchers gave 1 to 2-day-olds bottles of sugar water, which naturally prompted sucking. Then after a few days, before they gave the sugar water, they stroked the baby's forehead. Then after a while, when prompted simply by the stroking of his or her forehead, the baby would begin the sucking movement, even without the sugar water present. So this principle can be applied as early as the first week of life for those newborn babies, but researchers have found it's probably easier to obtain classical conditioning in the third or fourth week of life. Next, let's look at operant conditioning. This example could be found in your textbook in page 70, helping preterm infants learning how to suck. So preemies are known for poorly developed abilities on sucking. So researchers at Florida State University developed a very special pacifier called PAL, P-A-L, pacifier activated device, where a baby would start sucking on PAL and a CD full of recorded lullabies sung by young women would be played. So what they found was baby who used PALs actually has increased in their abilities of sucking compared to other preemies who didn't use PAL. So this suggests there's neurological basis for learning even as early as birth. So next, schematic learning. Schematic learning is where babies develop expectancies, which are often called schemas, concerning what actions lead to what results and what events tend to go together. For instance, if a baby hears a mom's footstep, she might move her head as if to search for the nipple once the mom enters the room. Habituation. Habituation is essentially the ability to get used to a repeated stimulus. Examples might include if you first move to a very noisy street, because you're new there, you'll notice every car that passes by, versus after a while, you quote-unquote habituate and don't really notice them anymore because you got used to them. A good way to think about habituation is how much energy it saves us, because if you notice every single stimulus every time it's present, it causes a lot of energy, and that's probably all that you'll do all day. Note that you can also get dishabituate to something, where you would be allowed to re-notice a stimulus if it's different enough than the original stimulus. So next we'll tackle temperament and social skills. Temperament is defined by the inborn predisposition that forms the foundation of later personality. Thomas and Chess are two researchers who started to categorize children based on their temperament in the 1970s. So you could either group children into easy or flexible, difficult or feisty, slow to warm up or fearful. And there's around 35 of other children who's probably a combination of 3 categories that just don't fit nicely into one. A couple things to note about temperament, and we'll tackle this in later chapters. But temperament can often change in the early weeks, but becomes increasingly stable by the age of 3. And what's to note about age 3 is if you have an extreme temperament at age 3, that could carry over into adolescence and young adulthood. So, temperament is something that's biologically based. However, parenting practice is crucial because temperament can change and be changed. So, this is something to note and not feel entirely hopeless if your child fits into maybe difficult or maybe slow to warm up category. For more information on temperament, you can refer to your textbook, page 70 to 72. So the last section we'll talk about in this lecture is health and wellness in early infancy. So nutrition. What nutritions do baby need in early stages of life? You might have heard the phrase breast is best. So this is referring to breastfeeding being superior nutritionally speaking. For instance, it contributes to more rapid weight gain. Infants are less likely to suffer from common illnesses like the cold. It stimulates better immunity overall in the long term. But do note that this may not be possible for all mothers. So this is something that's highly encouraged but should not be forced. So following the previous slide on breastfeeding, a different method of feeding could be bottle feeding and formula feeding. This can also be of high quality, especially nowadays in industrialized countries. There's even a lot of special needs formula that could be provided to the infants. Babies are still being fed and cuddled in the same way as breastfed babies, so they're said to have the same social benefits, even compared to breastfeeding babies. You might have heard from the older generations that in order to get a baby to sleep through the night, feed them solids or put rice cereal in their bottle. This is actually highly not recommended and not encouraged by the American Academy of Pediatricians because research has shown it actually does not encourage babies to sleep longer. And you really shouldn't introduce solid food until 4 to 6 months of age. And their first food should be rice cereal with iron fortified. So lastly, let's look at well baby checkups and SIDS. Well baby checkups are routine medical appointments where parents take their child to a medical profession to have their infant's motor skills, general health, and developmental milestone checked by a professional. This is a great way to detect any kind of problems early on and do early screening or interventions whenever it's needed. Well baby checkups are also really essential for babies to receive vaccinations. Vaccinations are given to prevent diseases, and in the US, vaccination rates are extremely high. However, the public can get complacent if some of the diseases don't occur anymore, so continued education and efforts in governmental support are needed to make sure vaccinations are being given. So lastly, we'll look at sudden infant death syndrome, or SIDS. This is where apparently healthy babies die suddenly and unexpectedly. And in the US, for infants above 1 month of age, this is the leading cause of death. There's various hypotheses as to why SIDS would occur in some babies versus others. Examples could be if an infant sleeps on his or her tummy, they're more likely to get SIDS. However, do distinguish that SIDS is not suffocation. Those are two different things. Other risk factors might include smoking by the mother during pregnancy or other people in the home. And with autopsies of SIDS baby, what the research has revealed is their brain often shows delay of myelination or deficiencies in neurotransmitters. So it could be something in their brain, and it could be something related to their sleep pattern. So this is just something to think about.